Epidemiology of the cancer is basically the study of the incidence of a cancer, the causative factors of the cancers, and the preventive measures and the risk factors for causing of the cancers in a population, in a general population. The global impact of cancer due to increasing population size and age. By the year 2030, it is estimated or projected that the number of cancer cases or the cancer-related death worldwide will increase to 21.4 million and 13.2 million respectively. Cancer is ubiquitous. You can't get rid of it. Um, if you are surviving, you are going to be in a chance or increased risk for any time you may develop cancer. Yes, the one way to avoid cancer, as the basis said, is to not to be born. As to life is to incur risk. However, there are remarkable geographic changes or variations among population in the incidence of the specific cancers that is believed to be mainly from the differences in exposure to environmental carcinogens, and assured that cancers are preventable. The major organ sites affected and estimated frequency of cancer death in the usually we are comparing with the United States. The most common tumor in men arises in the prostate, lung, and colon rectum, and in females, the most common cancers are breast, lung, and colon rectum. As said, the major organ sites affected in the uh, in frequency in men arises in the organ prostate, lung, and colon or rectum. In women, cancers of the breast, lung, and colon rectum are the most frequent site. There are some studies which shows that decrease uh, incidence of the cancers like in now present days or years by having as awareness of things like tobacco sedation and people are more prone to now or adjusted to avoid tobacco as mentioned in the cigarette packets. You have already seen that there's a precautionary pictures over there in the cigarettes packets to avoid smoking, showing the squamous cell carcinoma of the lip, etc. So decreased use of tobacco products is responsible for the reduction in the lung cancer death, and the same is the case with the breast cancer cases because of timely use of investigation like mammogram for the diagnosis of the cancer. Same is the case with the sharp decline in the number of deaths caused by the cervical cancers, especially in the United States, due to the timely use of the PEP smear test, which enable detection of the precursor lesions, which are later on to develop cancers. So, timely diagnosis of the precursor lesions and removal of it avoiding you to be develop cancers in future. In men, the most common incidence by site and sex. In men, it is lung and prostate, but the number one top cause is prostate, which is the most common uh, cancer in male, and then for lung. Same as and the female, the number one cause is the most common tumor is breast, okay, or cancer breast, and the second one is same as a lung cancer. If talking about the death related to the cancers, what is the cancer which are going to cause the most death? In male, it is lung cancer, not prostate. However, the incidence of prostate is common, but the cancer death are largely seen in the lung cancer. And in the female, the most common cancer incidence is breast cancer, but the death related to the lung cancer as compared to men is also there. In environmental factors, we have the list like infectious agents, smoking, alcohol consumptions, diet, obesity. These all comes in the heading of the environmental factors. Like if we are talking about the infectious agents, the HPV, human papillomavirus, is an agent that is spread through sexual contacts, seen in the females having the multiple sexual partners, and the one who are using the unprotected sex is responsible for the large majority of cervical carcinoma in females and the head and neck cancers also. About smoking, cigarette smoking is the single most factor which are going to cause lung cancers, or it can cause any cancers in the body and involve any organ in the body. Like smoking, particularly of cigarettes, has been implicated in cancers of the mouth, pharynx, larynx, esophagus, pancreas, bladder, and whatever the organ. If you are smoking and the chronic smoke, you are more prone to develop the cancer in any of the site. Scenario same with the alcohol abuse alone increase the risk of carcinomas of the oropharynx, larynx, esophagus, and the development of the alcohol cirrhosis, hepatocellular carcinoma of the liver carcinomas, and the alcohol and tobacco mix. If someone is taking both, then there's an increased risk of cancers in the upper airway and the digestive tract. Dietary factors are also there. If someone is having a fiber diet, means he's utilizing or taking enough vegetables and the fruits, then it is less chance to develop colorectal carcinomas in these type of individuals. However, if someone is on taking large of the part of the meal is related to the red meat and and very less or no food intakes or the vegetables or the low fiber diet, then they are more prone to develop colorectal carcinomas. In reproductive age, as the estimation is exposure is going on, then and especially if someone is having unopposed um, estrogen, means progesterone is not there, so estrogen non-unopposed by progesterone, so there are increased risk of cancers of the breast and endometrium due to these hormonal disbalances. Environmental carcinogens are always there, like ultraviolet radiation or rays, or drinking well water, which is consisting of which are having arsenic, particularly in the Bangladesh. And if someone is taking medication, methotrexate, and the one who is going to be work, which is supposed to be asbestos, occupational cancer's heading, then he is also come in the heading of the environmental carcinogens. A chart is there for the environmental carcinogens in the next slide. Yes, the chart of occupational agents which are going to cause cancers, so known as occupational cancers. Important ones are arsenic. They are found in components of rice, electrical, and semiconduction devices. So this is important one, and then the fungicide and herbicides as well. So arsenic, which is going to cause lung cancers and then skin cancer. So this is important. If someone is going to ask you a skin cancer related to the occupation, then arsenic may be a likely possibility. Asbestos is usually found in the construction as well as the fire resistant textiles and in the floor tiles. It causes lung cancers, especially it is also causing mesothelioma. So usually you ask scenarios about the mesothelioma associated with the asbestos occupational agents. Benzene is very important one. It is usually asked that benzene, if someone is having working in the environment of the painting and the paint, rubber or factory, and it is likely to develop AML, acute myeloid leukemia. Beryllium um, you seen in the uh, scenario of nuclear reactors, missile fuels, and it causes lung carcinoma. This is also very important. Cadmium related to the prostated carcinomas. Scenario will be like if the individual is working in the batteries, the companies making industry making batteries or the alloys and the metal platings, then and the patient is having a problem in the urine, it's showing the um, so and the patient age is adult age, and he's having the agent cadmium, so it is likely to cause prostatic carcinoma. Chromium compounds found in the metal alloys paints, and it is causes lung carcinomas. Vinyl chloride is very important, usually asked in the scenario of the hepatic angiosarcoma. Age itself is a very important influence on the likelihood of having a cancer. Most cancers or carcinomas occur in the uh, elderly life or the adult life, about 55 years or more than of it, and it is the main cause of death among women aged around 40 to 79, and the men age 60 to 79. The decline in the death after age 80 is due to the lower number of individuals who reach this age, and the factors likely to be explained in the incidence of cancer with regarding to age is due to the accumulation of the somatic mutations, which will going to cause malignant neoplasms. Uh, as said in adults, the carcinoma is the most common general category of the tumors, but not the case with the children's. Children's having the acute leukemias on the top list, and the common neoplasm of the infancy age or the childhood age are called to be a small round blue cell tumor. A small round blue cell tumor comprised of the neuroblastoma, Williams tumor, and retinoblastoma. They are giving the name of small round blue cell tumor because of the histological or the microscopic view presentation. The tumor cell shows small and rounded appearance and a dark nucleus. Acquired means you are developing some your environment or there are some causes uh, which are going to cause cancers. Acquired conditions predisposed to cancer can divide into the three categories, general categories like chronic inflammation is there, and the precursor lesion is there in the body, and the patient is having the immunodeficient states. The tumor arises in the phase of chronic inflammation, are mostly carcinomas. Immunodeficiency state predisposed to virus-induced cancers. Precursor lesions can be defined as localized morphological changes that are associated with the high risk of cancers. All precursor lesions arises in epithelial surfaces and are associated with an increased risk of various forms of cancer. Basic pathophysiology like chronic epithelial injuries, if it's there, then it's often leads to a metaplasia. What is metaplasia? It is the replacement of one cell type to a second cell type that is better able to survive on the ongoing insult or the ongoing injurious environment. In short, this is adaptive changes. The organism must survive, and the damaged cells can be repaired or eliminated later on. However, if the chronic injurious agents or the infections uh, has been there for the longer time periods, means year to decades, and then they may allow cell with potential to have got the oncogenic mutations to survive, leading to the cancers. The example of this is the chronic inflammations and the cancers, as for example H. pylori gastritis, which I said in the one of the my practical, that H. pylori infections, the bacterial infections usually occur by the mode of the oral fecal route. When you are going to have food the one at the street level or the vendors levels, then there's a chance to develop the H. pylori gastritis. It reside in the stomach, and if it's there for the decades, then it may cause gastric cancers or lymphomas. And one of the example, if I recall now, is if someone is having a chronic sinus discharge, a sinus tract. A sinus tract is the opening tracts uh, on the surface. If someone has a chronic inflammation like osteomyelitis is there, is an inflammation of the bone, infection of the bone, if it's there, or any of the infections which are going to have a sinus tract, a chronic tract, which are going to discharge pus, of blood, XYZ. If it's there for a long time, if the sinus tract or the chronic infection is there, inflammation is there for a long time in the sinus tract, then the sinus tract can develop squamous cell carcinoma. In some population, the cancer is been run in families as an inherited trait. It is usually due to the germline mutations in the tumor suppressor gene. As one of the examples, the BRCA1 and the BRCA2, which are tumor suppressor gene, are seen in the families of the patients having the breast cancers. Also, this one should be kept in mind that even in tumors with a well-defined inherited components and families, the risk of developing the tumor can be greatly influenced by the non-genetic factors. Points to remember: the incidence of cancers depend or varies among the geographical locations, age, the gender, and the race you have, and the genetic backgrounds. Cancers are most common in the adult age, more than 60 years of age. Like if the prostate cancer usually seen in the more than 60 of age, though adults are involved as well, and children and even infants are being involved with the tumors and the malignancies. The environmental factors are the carcinogens. Genesis include infectious agents, acid, HPV, H. pylori, and Epstein-Barr virus. Smoking is there. Alcohol diet means if you are having a low fiber diet, then you are more in a risk for the colonic cancers. Obesity is there, reproductive history, and the exposure to environmental carcinogens, the chart I have already mentioned.